Chronic fatigue syndrome is also known as ME, which stands for myalgic encephalomyelitis. Chronic fatigue syndrome is a complicated disorder and it's characterized by extreme fatigue that lasts for at least 6 months, and it can't be fully explained by any underlying medical condition. The fatigue worsens with any physical or mental activity, and it doesn't improve with rest. Only a small percentage of people recover to full health. People with chronic fatigue syndrome tend to frequently pick up coughs and colds, and they also have trouble fighting off whatever they pick up. They're more susceptible to and affected by invaders such as viruses, bacteria, parasites, candida, and toxins. People with chronic fatigue syndrome also have a higher occurrence of allergies than the healthy population. The endocrine systems of people with chronic fatigue syndrome tends to be out of balance. Cortisol and DHEA are hormones released by the adrenal glands, and they're invariably low in people with chronic fatigue syndrome. They work together to control how the body responds to stress. Low levels of these hormones can cause fatigue, hypoglycemia, poor brain function, allergic reactions, anxiety, and many other problems that are all associated with chronic fatigue syndrome. Here's 9 types of different pharmaceutical drugs that have been linked to causing and contributing to chronic fatigue syndrome. First, you have blood pressure medications. These tend to depress the entire nervous system, as well as deplete the body of vitamins and nutrients that it needs to produce energy, which can be a major trigger of chronic fatigue. Besides all the other extreme negative side effects of taking statins, one major side effect that's often overlooked involves the drug's tendency to inhibit muscle growth and the production of energy at a cellular level. As a result, many people who take statins experience a steady decline in energy levels occurring over time, which then develops into chronic fatigue. Benzodiazepines are commonly prescribed to treat anxiety disorders, and it's induced sedative effect that tends to elicit drowsiness, which often worsens as the patient develops a tolerance to the benzodiazepines and begins taking higher doses of these drugs. The end result for many people taking benzodiazepines is a chronic lack of energy and drive, which is also known as chronic fatigue. Poor diet and a lack of vital nutrients tends to cause acid reflux and various other digestive disorders in many people. And while proton pump inhibitors can offer immediate relief from such symptoms, these drugs also tend to deplete magnesium stores in the body. And magnesium deficiency can lead to a host of severe illnesses, including extreme weakness and fatigue. Histamine blockers often induce tiredness and drowsiness in patients as well, which over time can worsen and develop into chronic fatigue. Serious behavioral disorders such as schizophrenia and bipolar disorder often call for harsh antipsychotic medications, but because drugs like these are powerful depressants, they tend to induce extreme fatigue, lethargy, and overall weakness in many patients. Antipsychotics also tend to artificially lower dopamine levels in the body, which can also lead to chronic fatigue. At least 30 million Americans now take some type of antidepressant drug to manage anxiety disorders like depression, as well as to treat chronic pain and other related conditions. And while common antidepressants mask undesired symptoms in some patients, they also tend to trigger fatigue, especially during the first weeks of treatment, by inhibiting the normal function of brain neurotransmitters like serotonin and norepinephrine. Antidepressants also obstruct natural hormone levels, which in turn can lead to long-term chronic fatigue. Another common yet unsuspected side effect of taking antibiotics is that they often cause extreme fatigue and tiredness. Many people who have trouble urinating or have high blood pressure take diuretic drugs to help boost the elimination of water from their body. But diuretics also tend to draw out necessary electrolytes like sodium, potassium and chloride from the body, which this can lead to severe mineral deficiencies. And it's these deficiencies that can bring about chronic fatigue, as the body struggles to produce enough energy due to the lack of proper nutrients. As the primary target is the nervous system, chronic mercury exposure can cause symptoms such as fatigue, weakness, headache, and poor recall and concentration. In severe cases, chronic exposure leads to intellectual deterioration and neurological abnormality. One possible way that you can be exposed to mercury is through mercury amalgam dental fillings. Interestingly, the amount of damage that these fillings can do varies greatly from person to person. For one reason, some people have more acidic saliva, which leaches more mercury from the fillings than others. A urine mercury test may not detect any toxicity, as mercury gets taken up and lodges in the brain, where it needs a chelating agent in order to remove it. Some of the best herbs to help chelate and remove the mercury, which can cross the blood-brain barrier, are cilantro, which is also known as basil, and chlorella. Your body also uses selenium to help produce glutathione, which is known as its master antioxidant, and then it uses this to remove the mercury. If you're experiencing mercury toxicity, your selenium levels can be drained, and your glutathione, which is normally carrying out many beneficial functions, ends up getting wasted on removing this mercury toxicity. In order to get your required daily dose of selenium, you can eat 3 Brazil nuts per day. A high percentage of people with chronic fatigue syndrome are affected by everyday chemicals. This is known as multiple chemical sensitivity. Perhaps the brain is more sensitive to chemicals and causes the person to have a strong physical response. There also seems to be a consistently low level of the body's most powerful antioxidant, which impairs its ability to fight off the toxins and the free radicals. When there's not enough glutathione available in your blood, cells and liver, these toxic chemicals start to build in your body, and that's when you start to feel tired and even foggy. Some possible signs and symptoms of a glutathione deficiency may include anemia, the buildup of too much acid in the body, known as metabolic acidosis, frequent infections, and symptoms caused by problems in the brain, which can include seizures, intellectual disability, and loss of coordination. You can increase your glutathione levels by taking reduced glutathione at up to 1 gram per day, taking N-acetylcysteine at doses of 500 milligrams 3 times per day, taking the herb milk thistle, getting your selenium levels, and eating asparagus. A significant proportion of people with chronic fatigue syndrome have food intolerances. There's often an improvement in their health when certain foods are eliminated. An undiagnosed digestive or assimilation condition can interfere with energy production and can also affect nutrient absorption, leading to chronic fatigue. One of the most common undiagnosed problems here would be a gluten sensitivity. It's worth trying 1 month gluten-free to see if this makes any difference on your health and well-being. You should note, as gluten acts on the same receptors as opium, it can be very difficult for some people to abstain from it. Gluten can be degraded into several morphine-like substances, named gluten exorphins, and these compounds have proven opioid effects, and they could mask the deleterious effects of the gluten protein on the gastrointestinal lining and its function. It's important to also note that gluten crops are grown in glyphosate, which is Roundup, fields, and many symptoms of glyphosate poisoning can be misinterpreted as a gluten sensitivity. Studied strains of probiotics have demonstrated a significant effect on modulating the anxiety and inflammatory process in chronic fatigue syndrome patients. The best probiotic is called VSL3. You can also try to add probiotic fermented foods such as kombucha, kefir, sauerkraut, and kimchi to your diet. Enzymatically preserved colostrum powder and the amino acid L-glutamine can help to heal a leaky gut, which can further help reduce toxin exposure and improve nutrient assimilation, helping with chronic fatigue. Digestive enzymes may also be a great addition to help speed up the nutrient assimilation at the start of this protocol. Carnitine is essential for mitochondrial energy production. Disturbances in mitochondrial function can contribute to or cause the fatigue that's seen in chronic fatigue syndrome. Previous investigations have reported decreased carnitine levels in chronic fatigue patients. The form acetyl L-carnitine should be taken in doses of 2 to 3 grams per day. Not only has it been shown to improve cognition, it also has life extension capabilities, especially when it's combined with the anti-diabetic substance alpha-lipoic acid, which is typically taken in doses of 600 milligrams 2 to 3 times per day. Vitamin B12 and a B complex. B vitamins play a critical role in beating chronic fatigue because the body uses them to metabolize energy. And since many people today suffer from B vitamin deficiency, supplementing with a B complex and a B12 in particular can make all the difference in alleviating tiredness and sustaining high energy levels. Make sure that you get a good quality multi-B vitamin with the B12 in the form of methylcobalamin. And then it may be necessary to also add a separate B12 sublingual 5,000 microgram tablet on top. Note that the blood test for a B12 deficiency can be unreliable, as food is now fortified with folate, and this can give a false reading on the test, hiding a deficiency. Mineral deficiency is another common cause of chronic fatigue, as a mineral deficient body lacks the ability to effectively regenerate cells and produce adequate energy. This is why regularly consuming full spectrum of ionic trace minerals, which can include nutrients like magnesium, chromium, iron and zinc, is vitally important for treating chronic fatigue. Some trace mineral sources are shieldjet, humic acid, and fulvic acid. Patients treated with magnesium claim to have improved energy levels, better emotional state, and less pain, as was judged by changes in the Nottingham Health Profile. 12 of the 15 patients treated in the test said that they had benefited from their treatment, and the patient's energy scores had improved. You want to take magnesium in the form of magnesium bisglycinate. You want to start to slowly increase your dose until you experience side effects of stomach discomfort or diarrhea. Then gradually reduce the dose until you reach your maximum tolerable dose that doesn't cause any stomach discomfort. As magnesium is required for the proper functioning of over 300 enzymes in the body, profound benefits may be noticed after a few months of supplementation. Just like magnesium being required for 300 enzymes, zinc is required for around 100 enzymes. Since zinc is a strong antioxidant, a present study supports the finding that in chronic fatigue symptoms, they're accompanied by increased oxidative stress. And the results of the tests suggest that some patients with the chronic fatigue should be treated with specific antioxidants such as zinc. Typical recommended doses of zinc are 30 to 50 milligrams per day. However, you want to be careful, as many forms of zinc are poorly absorbed, some as low as only 20%, meaning that you'd need 5 tablets to actually achieve the blood levels of one fully absorbable form of zinc. Bee pollen is considered by many to be the perfect food, as it has a unique balance of beneficial enzymes, proteins, amino acids, vitamins, and minerals. It's another excellent option for people who struggle with chronic fatigue, and the synchronistic effect of the bee pollen's multitude of nutrients can help to alleviate both physical and intellectual tiredness and provide long-lasting energy throughout the day. Maca has been used medicinally for thousands of years, particularly in South America, where it grows abundantly in high elevations. Maca is another powerful superfood that normalizes hormones and boosts energy levels, because it helps balance a variety of systems throughout the body. Maca is quickly becoming a go-to treatment for many people who are trying to cure their chronic fatigue symptoms. Antioxidants have been shown to be reduced and free radical production increased in those with chronic fatigue. Vitamin C is a powerful, energizing nutrient with an amazing potential to eradicate chronic fatigue symptoms. But typical oral supplementation with cheap ascorbic acid and other common forms of vitamin C can provide only limited benefits, as only a small amount of the vitamin C ends up being absorbed in the body, while the rest is eliminated. So the best form you want to supplement with, the most bioavailable, is liposomal vitamin C, which some say is equivalent to getting high doses of intravenous vitamin C injections. A continuous onslaught of ionizing radiation and fluoride chemicals, combined with a lack of iodine-rich foods in the diet, has left many modern people grossly deficient in necessary iodine. And it's iodine deficiency that causes many of them to feel sluggish, perpetually tired, and devoid of energy. This accumulation of fluoride, radiation, bromide, and other iodine-replacing chemicals in the body can severely disrupt glandular function, which in turn causes imbalanced hormones, poor circulation, low body temperature, and other problems linked to chronic fatigue. Thyroxine is a hormone excreted by the thyroid gland. Studies consistently reveal that an underactive thyroid is present in many people with chronic fatigue syndrome. The best non-toxic form of iodine to support the thyroid is nascent iodine. Another cheaper source would be bladderwrack seaweed. Ribose is an energy source that the body makes from food. There's some evidence that supplementing ribose may prevent muscle fatigue in people with genetic disorders that prevent sufficient energy production by the body, and it might provide extra energy to the heart during exercise in people with heart disease. D-ribose significantly reduced clinical symptoms in patients suffering from fibromyalgia and chronic fatigue syndrome. Typical doses are 5 grams, which is 1 teaspoon, taken 3 times per day. Ribose is also known as the only sugar that actually lowers blood sugar levels. Therefore, it may be of benefit for diabetics, also allowing them to reduce their insulin. Studies have suggested that coenzyme Q10 and nicotinamide adenine dinucleotide, known as NADH, the common antioxidant supplements, have cardioprotective effects and might relieve symptoms of chronic fatigue. NADH, though, is very expensive. However, its precursor, niacinamide, is much cheaper, and it may be of benefit. You can check out the benefits of high-dose niacinamide in my video on schizophrenia. The best form of coenzyme Q10 is ubiquinol, and doses should range from 200 to 400 milligrams per day. The mitochondrial boosting, energizing effect of CoQ10 can also be enhanced when taken with PQQ at doses of 20 to 40 milligrams per day. You can check out my other video on mitochondrial boosting supplements for more ways to do this. Curcumin from turmeric. There was significant attenuation of oxidative stress as well as TNF-alpha levels in a study, and these findings strongly suggest that during immunological activation there's a significant increase in oxidative stress, and that curcumin can then be a valuable option in treating this oxidative stress in chronic fatigue syndrome. Doses of curcumin can range from 2 to 5 grams per day. Its absorption can be enhanced with BioPerine, which is black pepper extract, or by taking it with fish oil, coconut oil, butter, or ghee. Results from a study show that a decreased availability of omega-3 polyunsaturated fatty acids plays a role in the pathophysiology of chronic fatigue syndrome and is related to the immune pathophysiology of chronic fatigue syndrome. So the results suggest that patients with chronic fatigue syndrome should respond favorably to treatment with omega-3 polyunsaturated fatty acids. Doses can range from 3 to 9 grams per day of an EPA DHA blended molecularly distilled omega-3 fish oil. Resveratrol may be effective for improving fatigue syndrome and enlarging the atrophic hippocampus by repressing apoptosis and promoting neurogenesis. Resveratrol is found in small amounts in red wine and in Japanese knotweed. It's been shown to increase the lifespan of mice by around 7%. Typical doses range from 500 milligrams to 1,000 milligrams per day of trans resveratrol. Patients with chronic fatigue syndrome have a reduced level of vitamin D in their blood. Studies in patients with other diseases, like diabetes, have also shown that reduced levels of vitamin D are associated with increased risk of cardiovascular disease, like heart attacks and stroke. You can get a 25-hydroxy vitamin D blood test to assess your levels and then supplement accordingly with vitamin D3 to correct any deficiency. Melatonin is a hormone released by the pineal gland. Its primary function is to control sleep patterns. During the day, the pineal gland is stimulated by light, and it communicates to produce chemicals such as serotonin to wake up the body. When light levels fall, the pineal gland signals the production of melatonin, preparing the body for sleep. Melatonin production appears to be disturbed in chronic fatigue patients, causing a lack of deep, restful sleep. People with candida or yeast overgrowth show many of the same symptoms as people with chronic fatigue syndrome. Studies reveal that the flora of the intestine can be disturbed by factors such as antibiotics, and this allows candida, which is always present in the body in a harmless form, to proliferate and cause ill health. Research has shown that an elevated level of candida overgrowth is associated with allergies, irritable bowel, fatigue, memory impairment, foggy brain, and muscle pain. In diagnostic labs where it's possible to test for yeast overgrowth, physicians consistently report a correlation between candida antibodies and chronic fatigue syndrome. Many people who have these conditions have reported dramatic health improvements through antifungal agents and antifungal protocols. You can check out my video on candida for more information and solutions to this. A significantly high percentage of people with chronic fatigue syndrome appear to be highly driven and put a lot of pressure on themselves. They're often perfectionists. There's no doubt that people with chronic fatigue syndrome have an impaired stress response, and there's also much evidence to suggest that stress impairs the immune system. Recently, meditation has been shown to reduce some of the stress symptoms of chronic fatigue syndrome. People with chronic fatigue syndrome can sometimes suffer from cognitive difficulties. They often feel overwhelmed by sensory information, such as sounds and smells, especially in busy public places. Their skin is often sensitive to the touch. Experts believe this could be explained by neurological dysfunction, which processes information as vitally important when it's not, making these people feel overwhelmed. This suggests that a deficiency in certain vital chemicals in the brain is present. You can check out my other videos on brain-boosting herbs, my video on nootropics, and my video on choline sources for many ways to help boost cognitive performance, which can help you deal with recovery from chronic fatigue syndrome more easily. Adaptogens are herbs which are renowned for balancing any and all imbalances in the body. They may be very helpful when dealing with chronic fatigue syndrome. Some of these herbs are ginseng, both Eleutherococcus and Panax ginseng, ashwagandha, reishi mushroom, cordyceps mushroom, schisandra berries, rhodiola rosea, etc. Chronic fatigue can have many causes, but luckily there are lots of proven ways to help to treat this condition. It's important to supply your diet with an abundance of nutrients, like a multi-B complex, a separate B12 and a niacin source, omega-3s, micronutrients, magnesium, coenzyme Q10, PQQ, D-ribose, etc. You can help to alleviate the inflammatory stresses that contribute to the chronic fatigue with powerful anti-inflammatories like curcumin and vitamin C. One of the best ways to help treat the inflammation is to cut out pro-inflammatory poison that is sugar and adopt a low carbohydrate, low GI, high fiber ketogenic diet. Remember, blood sugar level fluctuations can seem like chronic fatigue. Every time your levels crash, leading to the addictive behavior of seeking more sugar to try to falsely boost your energy again. You can see my other videos on blood sugar for more helpful information about this. You should stop eating processed food and instead eat antioxidant-rich vegetables and herbs whenever possible. You can help to detox from substances that can be interfering with energy production or causing fatigue and brain fog by increasing substances like glutathione and vitamin C. No matter how tempting or necessary it seems, you should avoid stimulants such as caffeine or yohimbine, as these only make matters worse in the long run. And a final part in treating chronic fatigue is to make sure that you have sufficient sleep. You can see my other video on herbs to help sleeping for more information about this.